So the pandemic's coming to an end, but we have a bunch of people who are not getting out into public life. And I coined a term, and it's called the cave syndrome, okay? There's the extroverts. There's these people, they're just ecstatic to get out. They're invulnerable, they're having a great time, they're in heaven. Then there's the introverts, okay? And they have fallen in love with the cave, okay? So now, what's this about? Well, it's really a variant of agoraphobia, of the fear of going out, but it's a real change to it, was not seen in our diagnostic manuals, that before is that it's kind of this fear of the virus, the fear of not being safe, the fear of feeling uncertain and fearful. Okay, so what kind of people do we have involved that really have this cave syndrome? Well, it's the elderly, people with chronic illnesses, it's people with immune deficient disorders, and really what we're focusing on here is people with anxiety spectrum disorders, all kinds of anxiety disorders. These are the people who really are very fearful and uncertain. Okay, so what I did was I came up with 3 diagnostic categories: mild, moderate, severe. I put them into behavioral terms so people could kind of recognize like where they are, okay? So, and I said 5 is the most severe. So the first mild is like, a 1 to 2 or so, okay? And these are people who are hesitant, like they don't want to go to the grocery store, they're hesitant to go to friends, they're hesitant to go to the cleaners, they're hesitant to go anywhere. So that is a real sign, the hesitancy. Then it's the mask. Although they're told they don't have to wear their mask when they're around vaccinated people and they're all vaccinated, they still wear their mask. Yeah, their daily living seems to be changed. Okay, so usually they don't have any associated disorders. Their level of functioning is 1 to 2, 5 being the worst. Then there's moderate, okay? Now, these people, they're far more locked in, okay? So these people, they get deliveries at the door. They don't see anybody. They're having trouble seeing family members. They're really much more compromised. They have associated disorders too, but mild. They're kind of 2 to 4 on that 5 being the worst spectrum. And these people too, they have trouble with their jobs. They have trouble with their families. They're deteriorating. That's the moderates. Then the severe. Well, I'm going to give you an example, and I think if you hear this, you'll understand. I saw a patient the other day. She was in her room, and she had a mask on, and I said, well, what are you doing? She says, well, I always wear the mask. I stay in my room all the time. I don't go out. I have been vaccinated. Well, no more need be said. Okay, so these people are really dysfunctional, and they have a lot of comorbidities, meaning associated disorders, and they're really a prisoner in their own home. Now, what are we gonna do? Okay, well, look, for some of the mild, even moderate, what we could do is come up with some accountability. Get a friend who really wants to be with you, okay? And then come up with a plan about how little things you're gonna do to get out of the house with your companion and be accountable. And at the same time, do it in little steps. We call it graduated exposure. The most difficult last, easy little steps with a lot of good reinforcement. And look, if it doesn't work, then seek some professional help. This can be fixed. We don't want a chronic problem, we want an acute problem. So get some help. There's cures for cave syndrome. Take care, good luck.
Don't suffer alone. At BregmanMD, we can help with our years of online therapy experience. Just give us a call or contact us online.